Kansas City Moms. I'm Sarah McGinnity, and I am excited to be here today with Dr. Chediar with Children's Mercy, and he is a child and adolescent psychiatrist. And we are talking ADHD today, which is a topic near and dear to me. I have an 11-year-old who we've navigated ADHD for the last since he was in third grade. But I know that we have lots of moms who are interested in this diagnosis and just how to navigate, the beginnings of it and then life, after diagnosis. So we're excited to have you here today.
Thank you. Thanks for having me.
So can you talk, just starting out, a mom who might be watching this and is wondering, like, could my child, be affected by this? What is the diagnosis process, and how does that symptoms of it maybe look different for a boy versus a girl?
Yeah, I think it's sometimes a confusing question because I have a lot of parents that wonder, is this just normal development? Is my child just young and having some issues with school? And is it just something I should watch, or do I need to do something about it? So typically, I would say, first of all, ADHD is most commonly diagnosed around age 7. And the reason for that is because you can imagine a 7-year-old is just entering maybe first grade. They're expected to sit still in class for the first time for an extended period of time. They have maybe more social demands, academic demands, and the symptoms that were already present come out. And that's part of the definition of ADHD. It has to affect your functional ability, whether it be social abilities or academic abilities for adults, work, and that sort of thing. And so those most commonly are identified in early grade school. Now, for the diagnosis, it can include signs of inattention and or hyperactivity and impulsivity. So you have to have impairment in one of those areas or both of those areas in more than one setting. So that means a child who is struggling at school but doing great at home, you might question the diagnosis. Could something else be going on? So if you're suspecting it, or maybe the teacher brought up your child's in first grade and they brought up that your child might be struggling a little bit with paying attention, maybe they have some disruptive tendencies in class, it might be worth getting evaluated. And what an evaluation typically looks like is you go to your doctor. It might be a primary care physician, a pediatrician. I'm a child and adolescent psychiatrist, so it could be a person like me or even a general psychiatrist. And they're going to interview you, kind of get the background from your perspective, talk to the child, and then probably request some feedback from teachers as well as caregivers. One scale that we commonly use is called the Vanderbilt ADHD scale, which basically is a simple survey that is pretty easy to fill out. Parents and teachers both fill it out, and it gives us some clues as to whether a child might have impairment in more than one area. You'd mentioned the question about boys versus girls. So boys tend to be diagnosed with ADHD more commonly than girls, and we see the rates being about 2 to 1. Now, some of that could be because maybe boys have more ADHD than girls, but oftentimes boys kind of skew to the more hyperactive or impulsive tendencies that can be disruptive in class. So some of it, to me, it feels like girls are being missed out on. If they're not causing a disruption in class, maybe they have the inattentive symptoms that just aren't being identified. So I would say boys being hyper isn't necessarily just boys being boys. And if girls aren't being disruptive in class, but they are having some challenges keeping up with schoolwork, maybe we dig a little further into whether there might be a tendency toward ADHD symptoms or not.
Okay. And can you address, I think in the past it's thought of as like a behavior problem. And so what is our understanding of what actually is ADHD, or what is going on in the brain?
Yeah, ADHD is a neurodevelopmental disorder. So someone with ADHD, they have a higher likelihood that maybe a family member had symptoms of ADHD. They might also have developed these symptoms without any family members having had it. That being said, by definition, the symptoms have to be seen in childhood. So maybe a teenager or an adult that says, I developed ADHD symptoms, you might have to, again, question the diagnosis and wonder what else could be contributing to that. Lots of people have focus issues for various reasons, but for an ADHD diagnosis, it has to be something that was present from early childhood. We have our brain, and the big front top part of our brain is called the prefrontal cortex, and this develops well into your mid-20s. This is an area that is involved in decision making, risk-taking behavior, impulsivity, executive functioning, focus, and attention. So until this part is fully mature, you're going to probably have some signs of inattention and hyperactivity. Some of it might be developmental, but again, if it's impacting your overall functioning in a negative way, it could be signs of something greater.
So once, say, you receive that diagnosis, what is the next step, or what are some treatment options, whether it's medication or, lifestyle changes? What are the options for parents, and kids?
There's a multi-prong approach to treatment for ADHD. Some of it is going to depend on a child's age, the severity of symptoms, what types of activities maybe they have going on in the evenings, and we take all of this into consideration with treatment. So to address core symptoms of ADHD, inattention, hyperactivity, impulsivity, medicine ends up being the first line treatment. It's the most effective treatment. It's the main treatment that addresses those symptoms directly. That's not to say other treatments aren't effective. And I would say if someone has very mild symptoms or they're very young, you might actually skew toward the other treatments. And the other treatments include both behavioral therapies, as well as lifestyle or environmental adjustments or modifications that can help a child. So the therapies often look like, especially in young children, parent training. So a lot of what we try to do in ADHD treatment is manage these symptoms. And oftentimes the symptoms are prominent at home. So we want parents to be aware and educated on what the child is going through and how to best support them. Schools also have accommodations that can be put in place to help a child be successful. And we can get into that a little bit as well. And then environmental things such as good sleep. A child that doesn't get good sleep is going to have poor focus. They're going to be cranky and irritable. Lots of signs that we see with ADHD, and a child with ADHD that has poor sleep is going to really struggle. It doesn't matter what kind of medicine you give them or therapies. So sleep is really important, making sure we're limiting screen time. And I know a lot of kids are dependent on screens for video games, YouTube, social media, and whatnot. Excessive screen time can also worsen some of these symptoms. Making sure they're getting good nutrition, getting sunlight, physical activity, all can be helpful in managing these symptoms.
I can personally attest to the parent training part. It's interesting how I think you know what to do, and then it's sometimes the opposite of what my instincts are of how to like manage the behaviors that we see because of it.
And that's true for providers as well. I mean, myself as a parent, I don't always practice what I preach because you go into this parent mode of frustration and thinking your child should be doing something differently than what you expect and or what they're showing you. And so it's just a natural thing that parents do. So parent training can be very valuable, even for professionals like me that deal with this every day.
Yeah, for sure. Um, so kind of, well, how about school? If your kid's in elementary school, how can you work with your teacher or your counselor to get them help during the day when sometimes I feel like it's most important?
Mm-hmm. Schools play a crucial role in the management of ADHD symptoms for a number of reasons. So, one, we talked a little bit about accommodations. So, a school can provide a child with an individualized plan to help them be successful. And that's individualized based on a child's needs. So, maybe it might look like giving them preferred seating in a classroom where they're not so distracted. Maybe the child needs additional breaks. Maybe it's modified schoolwork. Maybe they get a little bit more physical activity in the day, or they have a resource room where they can get extra help. So there's all sorts of things that a school can do to help a child be successful, especially one that has ADHD symptoms. The school nurse is going to play an important role. For example, they might be giving a child a booster of a medication at school, or might check in on them if they're already on a medicine to make sure they're not having any side effects or issues. Some ADHD medicines can suppress the appetite. So having school staff check on seeing if your child is eating appropriately. The medicines are typically active during the day. So parents often don't see the effects of the medicine during the day, and getting feedback from teachers is so helpful to understand if the treatment is working and if a child is successful. So we need to partner with schools if kids are going to be successful, especially with ADHD symptoms.
Yeah, for sure. And so then kind of back to the parent training. Um, what are some, tips you've learned along the way or, key points of, kind of maybe adjusting your parenting style or strategy to help a kid be successful, especially in the evening when those medications have worn off.
Yeah. The evenings can be challenging, especially, I mean, our medicines are really effective when they're working well. And sometimes early mornings can be very challenging when it's not effective yet. And the evenings when the medicines have worn off. So I think parents often go into this default mode of getting really frustrated. And I don't blame them because they're trying to get ready for work. There's lots of things they have to manage. And then you have a child that you're hoping can make better decisions than they might be in the moment. I think helping parents understand some of the developmental issues that are associated with ADHD is helpful. Understanding that their child's actions or poor choices might not be fully under their control. They might kind of default to that because that's just what stage they are in their development, and maybe they're undertreated. So setting expectations, I think, is helpful. It's also important that parents develop some strategies at home, just like the schools can provide in the school setting to help your child be successful at home. So that might be creating a visual chart to help your child with organization, limiting choices, not giving 10 choices, but maybe giving two, giving your child some control. But if you give too many choices, maybe that complicates things. If you're giving instructions, simple, concrete instructions, 1 or 2 steps rather than 4 or 5 steps. And then not getting too frustrated or angry. Or on the opposite side, if your child's doing something great, providing tons of praise. ADHD kids are getting reminded all the time. They're getting corrected all the time. So if we can recognize them for great things that they're doing, that's really meaningful for them to experience. So parents can play a big role there as well.
And can you kind of piggyback on that? Talk about how ADHD affects maybe emotions, or the emotional kind of management side for a kid.
Yeah, so when we have poor attention and impulsivity, we tend to very quickly react to situations. Maybe we don't think through things. So kids with ADHD oftentimes might feel like they have big mood swings or react very strongly to small stressors because they just automatically go into that mode where if something doesn't go their way, it's hard for them to see into the future and kind of be patient with situations. So irritability is very commonly seen. Meltdowns, outbursts, even aggression are common with ADHD. Back many years ago, they used to misidentify kids as having mood disorders when they'd have big outbursts. But what we're finding more and more, a lot of the time, that's untreated ADHD. It's just the child reacting to their situational stressors so strongly. And when you treat the ADHD symptoms, those mood symptoms oftentimes improve dramatically.
Yeah, I know in our house it was almost easier to manage when he was younger. But
Mm-hmm.
now that we're entering like social situations or just more complex, situations, environments, it's harder to manage that emotional piece or to teach, good skills.
Yeah, and this disorder, not only does it evolve over time as the brain develops, but just as you say, kids are faced with different demands at different stages in life. So the symptoms and severity of symptoms are going to change. It's not that it always gets better or worse over time. It evolves with whatever situations that a child is dealing with, which, as we know, they grow up quickly and they go through a lot of different situations. So you're going to see a lot of different responses to those situations.
So perfect segue into my last question of what is the future look like for an ADHD kid? Is there do some outgrow, and what can parents expect?
So ADHD is, as I mentioned, a neurodevelopmental disorder. It's most prominently seen and identified in early childhood or in childhood years. However, as the brain continues to mature and develop, we do see that symptoms of hyperactivity, impulsivity do also improve over time. Inattention tends to stick around. So inattentive kids tend to be somewhat inattentive as adults. But as we get older, we also develop strategies to manage that kids may not have. For example, maybe making lists or setting alarms or surrounding yourself with people that kind of help keep you on track and organized. And so adults tend to have less ADHD burden than children. Of the children that are diagnosed with ADHD, about a third of them retain that diagnosis into adulthood. So adults are commonly diagnosed with ADHD if they had those symptoms in childhood, but the really in the long term, the burden is much less, and they tend to do better than children with those symptoms.
When we got our diagnosis, our doctor said, well, when the child is diagnosed, you often, one parent is like, oh yes, which is not me. Other adult in my house.
Yeah.
But I think, what you say is true of, looking back, he realized, he had symptoms of it, but he, is a list maker and a, preparation and, over prepares, I think, to kind of compensate for that.
Sure. And like I say, we're becoming more aware of these symptoms, over the years. A lot of time in the past, some people were diagnosed with mood disorders when it should have been ADHD. We're developing better treatment for these symptoms, more effective treatment, not just through medicine, but also therapy strategies and school accommodations. So as we're getting more aware, we're also recognizing the symptoms more commonly. And that being said, we do miss a lot of kids who have ADHD. Maybe the teachers don't bring it to the parents' attention. Maybe the parents kind of normalize it and think that's just a normal developmental stage. But I do encourage families, if they're ever at all concerned, it doesn't hurt to get assessed by someone who sees this all the time and who can give some other additional insight into what might be going on. And maybe they say, you know what, your kid's fine. Let's just watch things over time. And that's great too. At least that provides some reassurance.
Right. So if someone's watching and does have that, question in their mind, their primary care doctor would be their first call to make.
Yeah, the primary care doctors do a great job with screening these things. Most kids who are identified at school end up at primary care first. And then some primary care doctors are really comfortable with even starting treatment. Some might refer you to a different provider who specializes more in treating ADHD, and either approach is totally fine. The treatment is highly effective. So no matter who is prescribing medicine or if that is necessary or the case, kids tend to be very successful with treatment.
Well, sounds like there's a lot of options. So I just thank you for your time, and hopefully, some moms watching this will, find some resources and, it's just some solidarity in the journey of, parenting our kids through their challenges.
Absolutely. And it is so common. I mean, about 10% of kids can be diagnosed with ADHD right now. So you're certainly not alone if you're dealing with it.
That's true. Thank you so much.
Thank you.